Hey everybody, Steve Daisy, orthopedic physical therapist, personal trainer, and strength and conditioning coach with PTbyPTs.com. Today I want to talk to you about how to exercise with knee pain using some very cool physical therapy hacks. Knee injuries or arthritis often scare a lot of people away from leg workouts, for very good reason. Knee pain hurts. It's debilitating. So let's talk numbers. About 20% of the population deals with some sort of knee pain. That's a lot of people. It's like 70 million people in the United States. Statistically, about 20% of people over the age of 45 are dealing with knee arthritis. I don't know how many people that is, but that's a lot too. If you're one of those people, that pretty much ends your ability to do something that's very, very helpful for your knees. It doesn't involve drugs, doctors, needles, surgery. That's exercise, okay? Knee pain doesn't have to stop you. I've been a PT for over 25 years, and it astounds people when I show them what they are actually able to do despite having knees that are often ready to be replaced. They're so damn arthritic. Okay, that's what I'm going to show you today, how to design a highly effective strength and muscle mass building program that will help your knee and not harm it. Okay? The key to understanding this is understanding the muscle and joint imbalances that typically occur in the legs. When a muscle above or below the knee becomes weak, that places an enormous amount of stress on the knees. I'm not making up what I'm about to show you. I'm going to put plenty of research up to back all of it up, and then we'll talk numbers. The main areas with imbalances are the hip abductors or gluteals, the hip adductors or inner thigh groin muscles, the hip flexors or iliopsoas muscles, the hamstring muscle group, the vastus medialis obliquus or the VMO portion of the quadriceps, and the calf muscles. What we want to do is create a program that hits all of these areas as aggressively as possible in order to gain real muscle mass and strength, but not so aggressively that it hurts your knees. Okay? So that brings up the next thing we should talk about, and that is what not to do. Okay? First, stop listening to physical therapists on YouTube or that you know, or anywhere, who are telling you that you can strengthen your knees doing quad sets, or short arc quads, or long arc quads, or straight leg raises. If you had knee surgery this morning and you're just coming out of anesthesia and you've stumbled across this YouTube video because your doctor told you you have a bad healthcare plan and you can't afford physical therapy, and this is what you come across, okay, yeah, you can do those exercises. They'll probably help you for the next 48 hours. But if you're trying to really actually strengthen your legs, that's not going to do it, okay? That's silly. That would be like me sitting here holding my arm up and going, oh, look, oh, I'm making my biceps stronger. They're getting big, they're getting strong. Okay, it just doesn't do anything. Okay. Second, stop listening to people who think everything centers around your quadriceps weakness. Okay, I know your quadriceps are weak. They probably are. I mean, do people with knee pain have quadricep weakness? Yeah, they do, but not always. Okay, in fact, sometimes it's the exact opposite. It's not uncommon to see younger people with knee pain and massive overdeveloped quadriceps. We see it all the time. Those people have huge muscle imbalances. Usually they have very weak weak hamstrings and gluteals, and overly strong dominant quadriceps. They're using their quadriceps much more than other people to do things like squat, to get out of a chair, to run, to brush their teeth. They're using the quadriceps for damn near everything. In people with knee arthritis, yes, the quads become weak, but that's mainly at the VMO, and it's mainly from deconditioning due to inactivity. It's not the cause of your knee pain. Okay? Or they have weak quads because they just have a ton of pain. Okay, if you've ever tried to use a muscle that controls a painful joint, you can't do it. Okay, that's because contracting it creates pain, so that makes it look weak. Okay, but the real reason it's weak is because it's painful, and the reason it got that way to begin with is because of the weak muscles above it and the weak muscles below it. Okay. Third and lastly, stop listening to people who tell you to do knee extension exercises. Okay, stop that. The stress that this exercise puts on your knee is insane. It's as much as 12 times your body weight. Here's a study that shows that. And for what? Okay, we don't even use our quadriceps in this way at all. Okay, this is a great way to beat the living bleep out of your knee and your kneecap. The only people who should be doing this exercise are bodybuilders who make their living building up their quadriceps and need to do whatever the heck they can to make them big. Okay, but this is not an exercise that you should be doing to help your knee. It's not going to do it. It's going to hurt your knee. The exercises I am going to show you will address the most common muscle imbalances that we would constantly see in a physical therapy clinic. Okay, but we're not going to use the little piddly little rinky-dink PT exercises. No little flimsy bands, no little balls, nothing like that. Okay, we want a real workout. We want one that creates fatigue in that 8 to 12 rep range so that you can actually get stronger and more muscular. So let's get started.
Let's start with the leg press. Performing any closed chain exercise with your feet in contact with either a plate or the ground can potentially bother the knee. This leg press variation I'm going to show you offers the best chance for you to be able to do it without irritating your knees. Studies show that the leg press generates less force at the knee than the squat. Also, when the feet are placed high, wide, and pointed outward on a leg press platform, most of the work is done by the hamstrings and gluteal muscles. There are numerous other studies you'll see in a moment that show weakness of the hamstrings and gluteals as a major contributor to knee problems, so this is an important area to focus on. Therefore, the way I would recommend performing the leg press is with the feet wide, high, and pointed out. Stop if you feel any pain in your knees. The majority of the fatigue you feel should be felt in the hamstrings and gluteals. The leg press does still work the quadriceps muscle group. To make the leg press favor the VMO portion of the quadriceps, place your hands on the insides of your knees and simultaneously push your thighs toward one another, or use a ball between your knees. This will activate your hip adductors, but will also activate the VMO as well. Focus mentally on the VMO area and you'll feel it get tired. Studies have shown for years that the imbalance between the more dominant quadriceps and the naturally weaker hamstrings contributes to knee injuries. What's more, a workout that emphasizes improving hamstring strength relative to the quadriceps has been shown to significantly decrease knee injuries in athletes involved in soccer, volleyball, basketball, and ballet. Therefore, some sort of hamstring curl is essential for a leg workout. The most common hamstring exercise is the seated hamstring curl. There's really nothing to it. Sit in the chair and bend your knees against resistance. The exercise I prefer is the Russian curl. This is sometimes called the razor curl or Nordic curl. EMG studies actually show that the Russian curl elicits the greatest hamstring response compared to all other hamstring exercises. What's nice is it can be done easily at home by just hooking your feet under a couch. In a kneeling position with a cushion under your knees, lower your entire body as shown as slowly as possible. You'll only be able to go so far, at which point you'll need to catch yourself so you don't splatter on the ground. Push yourself up just enough to ride the wave back up, all while pulling with your hamstrings. If you've never performed this exercise before, you might be shocked at how quickly your hamstrings will fatigue, especially if you're careful to do it slowly and under control. Try to keep your upper body as straight as possible the whole time. The only problem with the Russian curl is that some people with advanced knee pain can't kneel, which you need to be able to do for this exercise. If that's the case, go back to the seated hamstring curl, which just about anyone can do, even with very advanced knee arthritis. Next is the opposite of hip adduction, hip abduction or abduction. Studies consistently show that hip weakness in the gluteals causes increased stress at the knees. Further, strengthening the gluteus medius muscle in particular results in improved function and knee pain reduction. What we're trying to do here is activate the gluteals. The best way to do this is by kicking the leg to the side and back. A machine in this case simply won't do it. The hip is in a flexed position and can't kick backward. So we'll actually use the classic side-lying hip kick. No, definitely not the 80s version of this. The one we'll use is much more detailed than that. You can see here how my hand is on my pelvis. My right hand is actually pushing my pelvis and core forward so that the weight of my leg doesn't roll me backward. I'm kicking back behind me and up toward the ceiling at the same time. If I rolled backward, my leg would end up in front of my torso. We don't want that. The path is up and back. You should feel all of this in your gluteal muscles. What's nice is that even a 5-pound weight at the end of your ankle is a lot, so adding resistance is easy for this one. Hip adduction is the act of pulling your entire leg inward toward midline using your inner thigh muscles. The best way to perform this is through the hip adductor machine. Research has shown that people with knee osteoarthritis tend to exhibit weakness in the hip adductor muscles, and that people with knee osteoarthritis can improve significantly with hip adductor strengthening. This is another pretty dummy-proof exercise. Sit down, adjust the pads to the stretch you can tolerate, and start pushing. This should put absolutely zero stress on your knees, and you should easily be able to tolerate weights that fatigue you in the 8 to 12 rep range. The hip flexion exercise isn't generally something you see people do. You'd be surprised how much you can actually get out of it. Here we want to focus on the deep hip flexors, or the iliopsoas muscles, that are right up against the hip. There's a lot of research showing that deep hip flexor weakness contributes to knee pain. This can be performed in any gym with a cable and foot strap as shown. When they're available, a 4-way hip or multi-hip machine can work as well. The important thing is to maintain really good upright posture. Keep your thigh in midline and don't let it drift out to the side. As you pull your knee up to your chest, roll your thigh slightly outward such that the foot ends up facing inward just a little. This will activate the deeper hip flexors of the iliopsoas that are more involved with protecting the knee and the hip. If that slight twisting motion bothers your knee, then just lift straight up without rolling the thigh. But generally, it shouldn't bother the knee at all. Last is the calf raise. In this case, we'll perform it on a leg press machine where you can easily add weight and put minimal to no stress on the knees. Part of the calf muscle group actually crosses the knee and helps control it. And sure enough, studies show weakness in the calf muscles in knee pain patients, so this is a great area to strengthen. You'll want to keep your knees just slightly unlocked during this exercise in order to protect them. It's probably better to perform one leg at a time in order to cut down on the amount of weight on the machine. Always remember to stop if you have any pain inside the knee or around or behind the kneecap. All fatigue and burning should be in your leg muscles. If you have any pain in the knee joint, you can always limit the range of motion of the exercise as well, especially with the leg press. Hopefully you'll notice a lot of fatigue is occurring in the hamstring and gluteal muscles. These are two of the biggest muscle groups that tend to be weak in knee patients and that we often focus on in rehab. Of course, you can always perform this group of exercises as a standalone leg workout or as part of a circuit that includes cardio and/or upper body exercises.
Thanks so much for watching. If you want to learn more, please check out my website, ptbypts.com, personal training by physical therapists, where we have even more physical therapy hacks on how to exercise with knee pain using our 12-week knee recovery program, as well as online one-on-one personal training. If you enjoyed this video, please hit the like button, subscribe, check out there's a full article on this on my website, and I can answer any questions or comments you might have. Until next time, I'm Steve Daisy with ptbypts.com.